I've learned a lot. She's taught me a lot, and she's very patient, very nurturing to her patients and to everyone around her. So I've been having a good time, and I'm sad to leave next week, and I mean it.
A+. So we are located, as we said, in Rio Rancho. Our address is 1920 Westside Boulevard, Suite B. We're located next to Nusenda Bank and Taco Cabana and Gonstead. Just in case anyone wants to find us. During COVID, we've reduced our hours, so we're here from 12 to 5, Monday through Friday. We're not open on the weekend. But like I said, compounding is our specialty. So the majority of the prescriptions that we receive, we try to compound them within the same or the next day. And compared to other pharmacies who maybe take, 4 to 7 days to complete a compound. Besides compound medication, we also have a line of pharmaceutical grade supplements from Pure Encapsulations, Zymogen, and then we also carry CBD oil. Our phone number is 505-738-3328. And Paige, I don't know if you want to share the screen now. Sure. We are now on slide number 3. So the second slide is the one that kind of gives all of our company information.
Let me know. Can you guys see that?
Yes, perfect.
Okay. Oops. That's fine. Okay.
Yes. So this is the circulatory system. We thought it wise to, open up the presentation with something extremely complicated that we probably don't even understand. But it's very important to know that this is what, one of the systems that obviously keeps us alive. So it's very important for us to take care of it and to nurture it. And throughout the course of life, sometimes we encounter issues with our circulatory system, and that's what we're going to address today. We kind of wanted to pair our presentation with the services that are provided through Vessel Health. So we thought it wise to break it down into 3 different sections. So first we'll talk about heart function, then we'll talk about vessel health, and then we'll talk about vein health. So next slide. So what are the signs of having an unhealthy heart? Chest discomfort, dizziness, shortness of breath, lightheadedness, swelling in your extremities, nausea, cold sweats, headaches, and migraines. Some of these symptoms and signs, they can come on abruptly, or sometimes they can develop over time. So it's very important to, kind of monitor how you feel every single day. Monitor any changes that you make in your diet and your lifestyle, and very important to stay well connected with your primary care physician, so that if you did need a referral to a cardiologist, you'd be able to obtain that. Next slide, please. So some of the medications that are commonly prescribed to help with heart function, we broke this down into different classes. So the first one is your beta blockers. These work by lowering your blood pressure, causing your heartbeat to beat slowly and with less force. So some of the medications that you may be familiar with, they end in lol. So metoprolol, sotalol, propranolol. Then we also have a class of medications called your calcium channel blockers. These lower your blood pressure by preventing calcium from entering into the cells of your heart and your arteries. These medications are known as amlodipine, diltiazem, nifedipine. And of course, there are many more than this, but we just wanted you to be able to have an idea of, what class your medications fall into and what they're actually doing when you take them. Another class of medications that help with the function of your heart, they're called ACE inhibitors. These cause your blood vessels to relax and widen so that your heart's workload and requirement for oxygen is decreased. So if we were to look at the circulatory system, one thing that we feel a lot of our clients don't really understand is that, your body has blood flowing through it, but your heart also has its own blood supply. So it's very important for your heart's blood supply to be adequately maintained, because when it's not and oxygen decreases, then that's what causes the cells of the heart to die. And so this ACE inhibitor, just make sure it works to make sure that the amount of oxygen that your heart is actually requiring is much lower, so that what it is supplied is sufficient. These types of medications are enalapril, lisinopril. Next slide, please. And then, moving on from ACE inhibitors, when you get to your ARBs, there are a class of medications called ARBs. These block activity at the muscles that surround the blood vessels, and this causes the blood vessels to relax, and they lower the blood pressure by doing that. So candesartan, irbesartan, valsartan, so anything that has an artan is most likely an ARB. And then we have the diuretics, and these medications increase the amount of water and salt that it's excreted from the body. So furosemide, hydrochlorothiazide, commonly known as HCTZ, and spironolactone. So, the question that we chose to address during this presentation is, how do we link our typical patient who has, issues with their heart, they have a cardiologist, when do they know that they would need a compound? Or who would it be beneficial for? And so, someone who's had a stroke, after having a stroke, if you have been affected in such a way that you're not able to swallow pills, tablets, and capsules, then, using a compound may be beneficial for you. Dysphagia, if you have any pain or discomfort swallowing anything, a compound medication may be beneficial for you. Pharyngitis, tonsillitis, again, any issues with your throat or your ability or inability to swallow a tablet or a capsule because it may be uncomfortable, it may be inflamed, it may be painful, then a compound medication may be beneficial. If you have acid reflux, severe acid reflux where you've treated with omeprazole, you've treated with everything over the counter, you've treated with omeprazole, and this is a chronic issue, then you may benefit from using a compound medication for your heart. A gastrostomy or any type of enteral feeds, we have patients who have G tubes or they receive their nutrition via not by mouth, but they receive their nutrition through a tube. Those are patients that we also make compounds for because obviously they can't swallow. So we make it in such a way that they can actually infuse the medication into where they would normally receive their feeds. We have quite a number of patients who are allergic and sensitive to the commercially available products. So let's say you have been prescribed metoprolol and it's a pink tablet and you are allergic to red dye and it causes hives. You may definitely benefit from a compound because what we make at Olive Tree, we don't have any inert ingredients. Inert is more of a superficial word, but we don't include those types of ingredients in the prescription. So you can potentially eliminate your chance of having any type of allergic reaction or sensitivity to medication by using a compound. And then the last one is, the strength or the dose may not be commercially available. So for instance, metoprolol 50 milligrams, well, what if you only need 45 milligrams? Because at 50 milligrams, you have a negative reaction or you have a side effect. Then a compound medication may be beneficial for you. So some of the different dosage forms that we make here at Olive Tree Compounding Pharmacy, we make liquid suspensions, which are probably the most common for heart medication. Liquid suspension, it's very easy to administer and you can get very accurate dosing with it. That's probably why it's the most common. A troche is the same thing as a lozenge, something that you would park in between your cheek and your gum. It would dissolve over time. That one is a little less common, but it is possible to make. And then sublingual drops. Sublingual drops are really our least favorite because you may not necessarily get the same dose every single time you take it. So of these three, we highly recommend turning a commercially available product into a compound when you're in need, and the dosage form that we would recommend would be a liquid suspension. So what are some of the benefits of using a compound medication? We've kind of discussed this, in the previous slides, but very easy patient-specific dosing. So like I said, let's say you go to the cardiologist and, you have been prescribed metoprolol 50 milligrams. and you take it, and over the course of the month, you notice, you feel very tired, you're very weak, you used to exercise, and now you can't really exercise as much as you want to. Well, to step down from that 50, it would probably be a 25 milligram. Well, what if you wanted a 30 milligram? That's something that we would be able to achieve. Now, that 30 milligrams is going to be specific for you. So we don't make a 30 milligram for every single person that walks through the door, right? So the great thing about compounds is that we can make specific dosing for every single patient. And in doing so, we're able to decrease side effects and also avoid allergic reactions. Sometimes, pills and capsules, not so much capsules, but more pills, sometimes patients don't like the way they taste. So if we turn it into a suspension, we're able to flavor it. We do have, grape flavor, bubblegum, vanilla, peppermint. We have so many different flavoring options. Sometimes when formulations are turned into compounds, we run the risk of not necessarily having a great expiration date. So if you look at your pills, most of the time they're good for up to, let's say, a year. Well, in compounds, the most time that you would get out of a compound would be up to 6 months in terms of, when it would expire. So a lot of these liquid suspensions, we're able to date them, as far out as 2 months, which is pretty good because sometimes they're only good for 14 days. But we have data and we have special formulations that allow us to date them out about 2 months. And then cost versus benefit. The main thing to know is that here at Olive Tree, we don't have any insurance contracts. So everything we do is an out-of-pocket expense to our patients. We really try our hardest to work with our community members to make sure that it's worth it to them. It's something that they can afford on a monthly basis, and they're getting the benefits of the medication.
Alrighty, so as Didi said, along with compounding medications, we do sell pharmaceutically grade supplements as well, and one of them is being the Pure Encapsulations brand. And pharmaceutically grade just kind of means that everything is pure. So you're getting everything that is stated on the bottle with no added extras, and it's easily absorbed, which is what you want to get out of it. So the cost of it is worth it to you. So some of the most common ones that I found for heart health, the first one is called resveratrol. And this one has been associated often with the benefits of red wine, which I'm sure many of you have seen like on the news. Sometimes it's good for you, sometimes it's not, but,
Yeah.
but for the most part, it's been shown to have some cardioprotective properties, which is pretty awesome. So the active ingredient in it is just what it says, is the resveratrol. And the mechanism of action is just that it's kind of preventing all of these things that are inside of your body, such as eicosanoids, all these big words, COX-1 and 2, immune cells, all of these things cause inflammation within your body. So it's kind of just stopping that all at one time. Next slide. And it also, of course, has the cardiovascular effects, which it's kind of a hard thing for me to kind of grasp when I was looking at it. It's called the anti-fibrotic therapy. And again, it's stopping a few things, a few paths in your body that relate to your heart health. So angiotensin 2, all of these things relate to blood pressure, heart health, all of these things. The directions that it calls for is 1 to 5 capsules with or between meals, which is kind of a big jump, but it's up to you as the patient or to your provider what they instructed you to do. So the cost is $23 for 120 capsules, and that can range if you're taking the 1 capsule daily or up to the max of the 5 capsules daily. So if you're taking 1 capsule daily, it'll run you about $7.50 a month, about 25 cents a day. And if you're taking 5 capsules daily, it'll run you $22.40 for 24-day supply, about $1.25 per day. Potential side effects and precautions. So if you're using hormonal therapy, which is something that we do very commonly here at Olive Tree, is a lot of hormone therapy with troches, creams, a lot of that stuff, you want to use a little bit of caution. And also if you're pregnant or lactating, you really want to check with your provider as with anything else. The next one, I have a hard time saying this, is policosanol. I don't know if I'm saying that right, but this promotes the healthy breakdown of lipids, so cholesterol in your body, really helps with the platelet function. And the website stated that the cardiovascular effect kind of remains unclear, but if you're reducing your cholesterol, that's also helping your heart as well. So again, the active ingredient, I'm not going to try and say that again, but it's what it's called. Policosanol. So the mechanism of action, this is something that I've learned in pharmacy school, is kind of to stop the rate limiting step of cholesterol, which is just what your body is doing to create cholesterol. It's stopping that pathway along the way. There's an enzyme that'll be there to break it down. So it's inhibiting that enzyme so that way the pathway doesn't continue on to build cholesterol in your body. And then it's also preventing your platelets from sticking together through the making of thromboxane B2. So the directions for this one is the 1 capsule 1 to 2 times daily with meals. The cost for this one is $34 for 120 capsules. So if you're taking 1 capsule a day, it'll be roughly $11.27 per month, about 37 cents per day. And if you're taking the max 2 capsules daily, it'll be $16.90 per month, about 74 cents per day. So you can get a 2 or 3 month supply depending on it. And potential side effects and precautions, there is none known at this time, but again, if you're pregnant or lactating, you want to consult your physician before taking anything.
Awesome. So before we go on to some signs of unhealthy vascular function, just to wrap up. So we talked about the circulatory system just in general, and then we've broken it down into heart health. How do you know that your heart is unhealthy? We gave you some signs to look for. And then we talked about the medications that are used, the commercially available medications that are used, medications that you get from Walgreens, CVS, these medications that are used to keep your heart as healthy as possible. Then we broke it down to talk about, well, what if you can't necessarily use those medications because of side effects or allergies, or you need a specific dose? That's when you would check in with a pharmacist here at Olive Tree, and we can kind of come up with a regimen or a therapy that's specifically formulated for you. And then we've talked about the two different supplements that are good for heart health. So we'll move on to vascular function. And how do we know that our vascular function is dysfunctional? So we have numbness, tingling in our hands and our feet. Our hands are always cold, our feet are always cold, or we have swelling in our extremities, or changes in skin color, and then also joint pain and joint discomfort. So those are some symptoms and signs to look for that will kind of indicate that maybe something is going on with your arteries and your veins in your hands and your feet. So what are some common prescriptions? Again, these are commercially available prescriptions. We have cholesterol lowering medications, so your statins. We listed the goals here. So the goal of your LDL, you always want to have an LDL less than 100 and sometimes less than 70 depending on your risk level. So that's something that your cardiologist should be able to go into much more detail with you. But just know that statins, those are one class of medications that are used for not just heart health, but for vascular function as well. High blood pressure medication, those we talked about in the previous section. Our goal of blood pressure is less than 130/80. Hyperglycemic medication, so anything that is used to control your blood glucose, that will also have a direct effect on your vascular function. So the goals anywhere from 70 to 130 before meals, and then after you eat, your blood sugar should always be less than 180. So if you have a means of checking your blood sugar and it's not within any of these ranges, then it's definitely time to check in with your PCP, because having hyperglycemia can obviously have a negative effect on your vascular function. So any anticoagulants, these are medications like your Coumadin and what's new?
Xarelto.
Yeah, Xarelto. Those types of anticoagulants may not necessarily, it's not that you would go to your cardiologist and find that, you have a vascular dysfunction and you would immediately be put on an anticoagulant. Not necessarily, but it is a class of medication that can be used to help with vascular function. And then other medications that can be used for pain and symptom relief. So this can be anywhere from your ibuprofens, your Tylenol, all the way up to your scheduled controlled medications as well. So it just depends on how severe the condition is. So what are some special circumstances that require the use of compound medication? Much like in the section where we discussed heart health. So allergies, sensitivities to anything that's commercially available. Definitely you'd want to check in with your compound pharmacist here at Olive Tree to make sure that you get the benefits of the medication without having the negative effects. If any of the strengths and doses that are commercially available are not necessarily what your body needs, then we may be able to customize a formulation for you. This next one is really interesting because I've had a lot of success in treating patients with Raynaud's disease. And so systemic versus localized therapy. One of the medications that's used for Raynaud's is nifedipine extended release, anywhere from 30 to 120 milligrams a day. But what happens, when you take nifedipine by mouth, so this is systemic treatment, when you use it by mouth, you may experience side effects. So dizziness, swelling, muscle cramps, irregular heartbeat, weight gain. And those are things that a lot of patients with these types of conditions or, an unhealthy heart, these are things that you don't want to experience because it's making your condition worse. And so where we've had success is creating localized therapy. So a topical nifedipine cream, anywhere from 8 to 10%. We've seen a lot of patients with Raynaud's have great success. So in Raynaud's, when it's in its mild or early stage, those patients benefit from kind of keeping their hands and their feet as warm as possible, maybe wearing gloves and socks all the time. But then as the disease advances, that is not necessarily enough. And so you need to open up the blood vessels in the extremities to increase blood flow. And that helps with the pain and that helps with some of the other symptoms of Raynaud's. So a topical cream formulation, what we do is we have a special base where we infuse the medications, the active ingredients such as nifedipine, pentoxifylline, sildenafil, nitroglycerin. So a combination of these medications, a little bit of lidocaine in there may also be helpful, but we come up with a formulation that's customized for you. And basically you're able to rub that onto your hands and feet as needed. And of course, there'd be a limit to how much you could use per day, but then it's up to your discretion. So being that we're in New Mexico in the morning, it's colder, that may be where you experience the worst symptoms. You may just pull out your cream, use half to maybe 1 gram and put it on just like you would lotion, and that may get you through the day. Whereas, some other patients, they may need to use a bit more. But the benefit of a compound medication in this type of situation is the fact that it can be customized to you. One person may have a great response to nifedipine, whereas another client may not, and they may have a great response to sildenafil. So we have a range of options here at Olive Tree. Did you put it in there?
Yeah, I think she made that.
Oh, I think we went the wrong way. There we go.
Oh, one more. There we go. Oh.
Okay, this one. Oh no.
I think
go back one more. There we go. Okay. Yep, so we kind of discussed all of these already. So easy patient-specific dosing, like I said, nifedipine 8% may be great for you, or a 6% or 4%, whereas another person who's had Raynaud's for, let's say, 10 years, and it's really severe now in terms of the level, of the disease. They may need a nifedipine 10%. So it's very easy for us to customize a patient-specific dose. With this type of medication, a topical formulation, obviously we reduce the systemic exposure and the side effects. Although there have been reports where patients, even though they're only using it locally on their hands and their feet, enough of it does get absorbed and they do get dizzy, or they can feel the effects of the medication getting absorbed. So that's when we know that now what's the benefit of using such a strength to where you're having these effects? Can we lower the strength and still treat the Raynaud's or the symptoms of Raynaud's? Can we lower the strength? Can we make it a little less strong so that you wouldn't have the side effects? So we have the ability to do that. Whereas with a commercially available product like a tablet or a capsule, you wouldn't be able to change, how much you take. Again, we can avoid allergic reactions, and then cost versus benefit. We always like to tell our patients up front that it is an out-of-pocket expense. So something like 60 grams of nifedipine, which would probably last you a good month, depending on how much you use, that is about $60. So it really depends on how severe your condition is and what you're willing to try and what you can afford.
Alrighty, so some common over-the-counter supplements for vascular health. One of them I found was the Endolock 60s. So these ones offer support for cardiovascular antioxidant protection and also just support vascular health in general, as well as breaking down lipoproteins, which is just essentially cholesterol in your body. So the active ingredients in this one of them is berberine, and then the next one is N-acetyl L-cysteine. So the mechanism of action for the acetylcysteine is just to help you maintain those healthy lipoprotein functions, so the good cholesterol within your body, and also transport fat and other lipids in the blood. You don't want it to stay stagnant in your body. And then the berberine is included just to support your healthy blood sugar, which is important for your vascular health as a whole. You want to keep your sugars at a good level and maintain what's called a LOX1 gene, which is just important in keeping your endothelium, your blood vessels, very healthy and strong. The directions on this one is 1 capsule 2 times daily with meals. The cost for this bottle is $47 for 60 capsules, so 1 month supply. So it's the $46.40 exact per month, and then about $1.55 per day. Some potential side effects and precautions. This one is not to be taken by pregnant and lactating women. And then berberine has just been known to cause some headache, nausea, vomiting, abdominal bloating, and some slow heart rate in literature studies. And there has also been cases of allergic reaction to lychee fruit, which is one of the ingredients in this supplement. So if you know your food allergies, and one of them is to the lychee fruit, which isn't very common in Mexico, but still, you want to be cautious of that. And going backwards again, I think. There we go. Alrighty, the next one is the Vascular Relax 120. So this one just promotes vascular relaxation so that you're getting blood flow throughout your entire body and through your heart. So there's quite a few ingredients in this one. This one includes magnesium, olive extract, hawthorn extract, grapeseed extract, and lycopene. So the mechanism of action, the magnesium is just to support the healthy electrolyte function with other cells in the vascular muscle cells. Higher magnesium intake has been is associated with helping our vascular system relax. So again, helping blood flow get throughout our entire body, through our heart, and maintain a healthy blood pressure as well. The directions here are 2 capsules 2 times daily for meals, with meals. So the cost is $65 for 120 capsules, so about a month's supply, and you'll be paying roughly about $2.15 per day when you do the math. Potential side effects and precautions. Magnesium can be associated with some GI issues such as the nausea, vomiting, diarrhea. Very common over-the-counter medication for constipation is the magnesium citrate, so that causes your bowels to get moving. And then in some rare cases, the hawthorn has caused some dizziness, palpitations, headache, fatigue, rash. And then again, if you are pregnant or lactating, you want to consult your physician.
And if we could go back to that previous slide, sorry. So another key thing is that, the magnesium, there are different salt forms of magnesium, and this is where you really want to talk to your pharmacist, whether it's your retail pharmacist or one of us here at Olive Tree. The salt form of the magnesium is what's important. So magnesium citrate is what you would take if you are having bouts of constipation, whereas magnesium glycinate, a different salt form, a different amino acid form, that's beneficial for relaxation of muscles. So, when we say magnesium, your pharmacist really should be asking you what kind of magnesium. And that's something that we want our clientele to also know, that there are different forms. Another thing, when we talked about hyperglycemia and reducing blood glucose, there's another product that's called Cinnamon WS, Cinnamon Water Soluble. It's made by Pear Encapsulations. Very, very good product at helping reduce blood sugar, especially in the morning. So you take it before you eat breakfast, and it's water soluble. So you drink it with a full glass of water, and it will get absorbed. And that's another key thing that we stress here at Olive Tree, is using vitamins and supplements that are pharmaceutical grade, because you can take something, but if it's not formulated in such a way that you'd be able to absorb it, you don't get the nutrients from it. So these supplements, I told Renee when she put this part of the presentation together to list the prices, because we do understand that the cost per day is a lot more than buying an over-the-counter supplement from your retail pharmacy, but the cost is justified when you look at how the product is made and the very high quality and the bioavailability of the product. So that's why we listed that information. So what are some signs of unhealthy vein health or vein function? Again, kind of the same thing as with, heart health and vascular health, but restless leg syndrome. So when you finish your day, you go to bed at night, you're laying in bed and feel that tingling, burning sensation in your legs. They're kind of moving all over the place. They're just not settled. That's a sign that maybe something is going on with my veins. Cramping, swelling, heaviness and pain in the legs, leg ulcers, varicose veins, or tightness in the ankles and calves. Some common prescription medications, again, commercially available products that are used for vein health: anticoagulants, diuretics. And then there's a class of medications that are called the hemorrhagic medications. So an example of this class of medication is the pentoxifylline. So what are some special circumstances that require the use of compounds for vein health? Again, allergies, sensitivities, and then we've talked about this already, the strength and the dose of commercially available products. Maybe what you need is not necessarily available. That's when you would look into seeing if it can be compounded. And then again, systemic versus localized therapy. This is really a big issue when we talk about side effects. So, some of our clients, they don't want to experience the side effects when taking this medication or these medications by mouth, and so they seek localized therapy.
Alrighty, so some common over-the-counter supplements and vitamins for the vascular health. The first one is called the Nitric Oxide Ultra. So these capsules help support nitric oxide production. So this is a molecule in our body that helps dilate the blood vessels and the veins in our body, just to help support blood flow. So it contains a trademark product by Pure Encapsulations called Cranload, which is just cranberry and grapeseed extract that offer the vascular support just to help keep your veins and your vascular system very strong and healthy. So the active ingredients are the I-citrulline and then the Cranload, and the citrulline is just a different form of the main ingredient, citrulline. So it is used to support the making, again, of the nitric oxide in the blood vessel and other tissues, just to help keep blood flowing throughout your body. And then the cranberry and grapes are good sources of proanthocyanins, and this has just been shown through studies to support heart health as a whole. The directions here are 2 capsules, 1 to 2 times daily between meals. So you get 120 capsules for $64. If you are taking 2 capsules daily, then you have a 2-month supply, $31.60 per month, as well as the $1.05 daily. If you're taking 4 capsules daily, then the 1 bottle is good for 1 month, but $64, excuse me. and $2.10 per day. Excuse me, I put per month, not day. And the potential side effects and precautions, there was none known at this time.
Mm-hmm. And I have carried these little samples of nitric oxide powder in the powder form. So if you're new to olive tree, please mention that, and we'll be able to give you a little sample if you wanted to try it.
And lastly is the Synergy K. So for those of you who don't know Synergy, I learned this in school, it's just a bunch of different things kind of working together for one main cause. So this supplement has quite a few active ingredients of vitamin D and vitamin K. So it's, again, a blend of vitamin D and vitamin K, which promote healthy calcium utilization throughout your body, so your body's using calcium in the right way in order to maintain healthy bones and blood vessel function. So that's where the Synergy comes in. It's working on both your blood vessels and also helping promote bone health as well. So the mechanism of action, the vitamin D is helping potentiate the activity of a molecule called MGP. And this molecule likes to bind to calcium in order to prevent the vascular walls, so the blood vessel walls in your body, from calcifying, from getting hard. So it's not something, it's something good that you want inside your body, so this is helping as well. And the vitamin D is also good for your bone health as well, so it's helping strengthen both your bones and your blood vessels. And the directions here are to take 1 capsule daily with a meal or as directed by your health professional. So if your PCP wants you to take you more, you can't take less, then they will tell you. So the cost for this one is $33 for the 120 capsules, which will potentially go out to about $10.80 per month. So it'll be a 3-month supply for 1 bottle, about 36 cents per day. So this medication is contraindicated for individuals who are on dialysis. And again, for pregnant and lactating women, you always want to consult your physician.
Mm-hmm. Yeah, so the takeaway message is we are a compound pharmacy and we specialize in making compound medication, and we're here for our community. We're here to help you whenever you need a specialized therapy. You know, whenever you need something that's not commercially available, please give us a call. We are willing to work with other healthcare providers. So your PCP, your cardiologist, you at Vessel Health, we're definitely willing to consult, you know, form a collaborative team to help the patients that can benefit from compound medication. As far as the supplements, we don't necessarily carry everything over the counter, but we do have a great relationship with Pure Encapsulations in Massachusetts, so where we're able to order it, have it shipped to your home free of any shipping charge. And so that's something that we're able to do as well. But, you know, if you ever have any questions, please know that we are accessible. I've had many clients ask me if I'm the pharmacist, that they never talked to a pharmacist before. I'm like, why not? We're not robots. So if you ever have a question, even if you're not coming to get a compound medication, just to discuss something, we're here for you.
Thank you.
Mm-hmm.
That's really so much great information. And I think lastly, what you just said, of not being open to discussion with your pharmacist, that's like so vital.
Mm-hmm.
It's amazing. I've learned that just through family history and through you know, people in my own family who've had to experience medication therapies and understanding, you know, the what and how and whys and everything else. And sometimes you really do need to speak to your pharmacist about it.
Mm-hmm.
So I really appreciate that. And there was a lot of information here. Very, very, very thorough. Very good job, both of you. And I'm going to open this up because there might be some questions. I know I had a couple of questions, but let me see. I was just looking a moment ago to see if there were anybody's hands up. And I know we have 7 on the call. I don't know if everybody's muted, but you can hear me. This is Sally. Hi, I'm glad you're here. Does anybody have any questions for Didi or Renee?
I have one.
Okay, great.
Yeah. So Didi, this is not it's not related exactly to your presentation this evening, But my primary care here in Albuquerque does prescribe some compounded medications for me, and I pick them up here in town. But I was reading recently, is there a thing that the FDA is trying to get rid of the bioidentical? So is there something we should be doing, or?
Yes, ma'am. That's actually that's true. That's correct information. It's a constant struggle for an entrepreneur, an independent pharmacist, someone like me, to go up against these big guys who really think that more of the benefit is when the patient goes through an insurance company. They're all in cahoots, and really it's just us taking a stand and serving our communities, because if you look at the history of pharmacy, this is where pharmacy started, right? It started with a scientist behind a counter who would mix different things together and come up with a concoction and give it to you to drink or rub on, and you would miraculously get cured by this snake venom or, something random, And so it's so funny that now that we've standardized the process, they want to get rid of us. But a bunch of pharmacists all throughout our nation, we've come together on many occasions to take a stand. We know that we're special. What we do for our community, it cannot be replicated by drug companies, by insurance companies, by the FDA. And it's unfortunate that they're trying to eliminate us, but we'll be around for as long as we can. Yeah.
Well, Lydia, thank you for bringing that up, because if I know anyone, and I know how you are, you're very much an advocate. So any one of us that can advocate for you and others like you, we're happy to do that. Just, we'll kind of share information now that we've reconnected. If there's anything that's out there that we need to know about specifically, just please let us know.
Sure. Thank you.
Yeah. So does anyone else have any questions or comments or? Well, I know that some of the supplements that you carry are some of the ones that we are familiar with, that we also carry in the practice. So we have Zymogen, and I think we discovered that when we first met. We have Zymogen and their line of not everything that they carry, but we have what's suited to our needs, as well as we have specially formulated and partnered with them on some of these others. And I'm just curious, because there are some really, there's some similarities, but there's also some unique difference in some of the ones that you carry. So I guess it really depends. Like you said, our bodies are unique. So the supplement needs to be kind of, I think, tailored to whatever that is, whatever that, your bodily need is. So that's where I think you come in. We always open up, and let people know, yes, we have supplements. We have them online. We do a lot of specials, kind of like you. We want people to know up front that supplements typically are not covered by insurance, that kind of thing. So we have a lot of interests and just wanting to do the right thing by our patients. And I know that with your situation and I like the fact that you put this together in such a way where people will know exactly, because I'm one of those, I take D and K and all this, so I'm like all over this thing looking at all these different things. And there's, and the other thing that struck me that was really interesting was the dosing and how you might actually intake something. I'm not on that page right now, but I guess I never really thought about that, and that makes total sense. I mean, everybody, depending upon their situation, some people have a hard time swallowing pills or whatever it may be. Maybe, like you said, they're being fed intravenously, and there's just so many variables. So it's really vital that we all kind of know that this type of pharmacy needs are right here.
Exactly. Yeah. And I've built the business to really cater to those special needs, right? Like if you don't really need something as special as a compound, then you have so many options. But when I looked at this community, there there are no options, you know, so that's why we've built Olive Tree to be what it is. Going back to Zymogen is an excellent company. They spend millions of dollars making sure that their products are not adulterated or misbranded. And so I say that because if a client is purchasing supplements online through Amazon or through, you know, some kind of website, be very, very careful. If it's not coming directly from the manufacturer, you cannot be assured of what you're getting. I had a patient who normally would come in and get melatonin for sleep, and for some reason he just went online and purchased it, and when he received it, it was actually selenium. So two very different things, and he knew something was wrong, and he came in to show me, and I said, this is exactly why there are specific brands like Zymogen and Pure Encapsulations. You know, they put a ton of energy into making sure that their products are streamlined through healthcare providers. So if you're not going to a healthcare provider to get CBD oil, to get supplements, to get vitamins, then I would caution you. You know, so if you're just going on Amazon and picking the bestseller, you have no idea. The manufacturer could be in Turkey, and they're not regulated like how things are regulated here in the United States.
Absolutely. That's so true. And I don't think you can, I think everyone just needs to kind of err on the side of caution, like you're saying. So
Exactly.
And talk to your pharmacist.
Exactly. Yep.
Yeah.
Mhm.
Yeah.
There was a private question
Okay.
that popped chat.
Where did I go?
So this question says, it looks like it's from Jana.
Yeah.
So does a person just come in and see you, or do they make an appointment, and does the patient need a prescription? Oh yes, I'm so sorry, I forgot to address this. Yes, so everything that we make, every compound that we make in our lab, it is by prescription only. So if you just walked in and you're like, hey, I've had Renae's, can you just, you know, whip up some cream? No. so we'll need a prescription from your provider, and that prescription has to be detailed in terms of what needs to be made for you. And we understand that there are actually a lot of providers in our community who have no clue how to write for a compound medication. That's where we come in. We're able to make phone calls. We can talk to providers, and we can discuss what would be best for you, come up with a formula, and we can make it. If you just wanted to come in and talk to us about something that we have over the counter or something that you want us to order from you, you don't need to make an appointment. Just come right in. We do have a consultation pharmacist who specializes in hormone replacement therapy. So that's where we would prefer that an appointment is made. And then you come in and it's a sit-down consultation, or sometimes by phone, whatever is convenient for you. But to discuss our over-the-counter supplements, CBD oil, those things, we don't require an appointment. We're here from 12 to 5, Monday through Friday.
That's great. That's a great question, Jana. Thank you.
Yeah, thank you for the question.
Thanks, Dee Dee. You did a great job. I have a question that popped into my head when you were talking about topical formulations, and I think one of them was referring to blood pressure medication. But is there anything that you put in that topical formulation that helps carry it across the skin, or how does that? What's the mechanism for that occurring?
Yes, exactly. That's an excellent question, because a lot of people wonder, well, I'm just putting a cream on. How do I, how is it getting into my bloodstream? How is it actually going to go from my arm to my heart? And that's where the pharmacist has to really use, our training, our knowledge. That's where all of it comes together. And so there are specific bases that I use. So a base is, like a cream. It has different penetration enhancers. It has, different ingredients that allow it to go from topically onto the skin, deep down past the tissues, into the muscle, into the blood vessels, get absorbed that way. So the benefit of that is you avoid, obviously, a lot of side effects, but there's another thing that's called first pass metabolism, where you take something and it goes to your liver, and your liver chops it up. And some of it is rendered inactive. Some of it doesn't work. But when you apply something locally, topically through the skin, you can avoid that first pass metabolism. And that's why you may have to take nifedipine by mouth 120 milligrams, but when you use it on your skin, you only need, let's say, like a 4%. You need very little to get the same effect that you would get when you took it by mouth. So that knowledge right there, that's all housed in, in my system, in what I do.
Great, thank you. And I have a personal question for you. Most pharmacists probably go the traditional route for pharmacy. How did you get interested in compounding? What was sort of the pathway that brought you to this business?
Oh man, that's very personal. I was a terrible, terrible traditional pharmacist. No, I was not fulfilled in standing behind the counter and not being able to do stuff like this, not being able to be accessible to my community, that's truly what I believe, our role is in healthcare. We should be on the front line. We should be accessible. We have so much knowledge, right? I mean, it's ridiculous how much we learn. There's some courses that, we come together with med school students and we actually know more than them at a point in time, right? So I just felt like doing the same thing over and over and over, I had to break away from that. So that's how I ended up doing this. But I enjoy it.
Thank you.
Yeah.
Well, we're glad you are doing this. It's great. And then you have interns that you're passing along a lot of great knowledge and inspiration to. So that's wonderful.
Yes, thank you so much.
Okay, well, Paige, I'm looking to see, I don't see any other hands raised or anything else. How are we doing on time?
We're doing good. I have it scheduled for a little bit over an hour. So if anyone has any questions to wrap up, that's fine. And then Dee, is it okay if we share your contact info with our contact list to reach out to you later?
Yes, definitely. You can share our contact info and then also the presentation too. I don't know if you have like a listserv. You can just kind of email it out so that people know what we talked about. And if they have questions, they can always call us.
Perfect.
And I'll give Renee's personal phone number. Just kidding. We can call her.
I'm not as knowledgeable as her yet.
No, that's great. And I agree that that's a really nice thing to offer. And if we can put that out there, sometimes we're able to take recordings like this and presentations like this and share them through our website or Facebook or anything like that. So if we have your blessing, that's wonderful. And then we'll definitely do it.
Yes, definitely. Yep.
Okay.
Thank you.
Wonderful. Well, thank you. And thank you all that have come and listened to this great presentation. I learned a heck of a lot. I know you did too. And I'm getting compliments coming up on the screen. So that's great. Nice. We thank you for your time and energy and all that you've put together. And glad we got to reconnect. And I'm sure this is just another connection that will continue. And we'll do some more things together. So it's a wonderful opportunity for us. Thank you so very much, Dee.
Thank you. Thanks for having us.
It was our pleasure.
Have a good night.